HD. This is Fox 6 News at noon.
Hey, welcome back in to Fox 6 News at noon. I'm Mike Deverly, and we're talking about a procedure that a lot of men at some point in their lives will want to go through. We're talking about vasectomies. That's right. This is Dr. Rodney Dennis. He is with Urology Associates of Alabama, and we're going to tackle this subject now. And March Madness is upon us, so millions of Americans are thinking about that, but maybe we need to think about other things as well, in particular this, because I know a lot of men have questions about it. I imagine most guys, when they're thinking about, oh, I may have to get this done, is it going to hurt?
Usually not.
Yeah.
Sometimes patients will want Valium as a sedative. We're willing to give that if they want it. We always use a local anesthetic though, so usually it's not a painful situation.
Now, is it pretty much just you and an assistant? Is it just you normally when the guy goes in and gets it done?
An assistant helps me get things prepared. Once I have everything in place, it's just myself and the patient.
Okay. And then the other question a lot of guys might have is, will it hinder your sexual performance?
No, not at all. It shouldn't have any effect on that or your libido or anything else.
Okay. And by the way, I know that after you have it done, you might be a little sore, but I guess you use a lot of frozen peas, right, to remedy that situation. How long does it take before you're back to normal?
I always tell patients to use the frozen peas intermittently for a couple of days, but avoid lifting, straining, intercourse, anything like that for 5 days.
Okay.
Usually after several days they're able to get back into the routine, although it usually takes about a week to get back to baseline.
So now when you have it done, is it permanent in terms of for birth control?
Well, we hope so. That's our goal. We always want to have patients bring back a specimen after 15 ejaculations just to make sure that there are no sperm.
Right.
But if there are not, it should be a permanent situation, although it can be reversed.
Mm-hmm. Well, now, during a guy's life, let's say he has this done relatively at a young age, and 40 is kind of young maybe, maybe 35 he has it done, but he says, well, maybe when he's 50 things change in his life and he gets remarried, and the person he's married to might want to have kids. What are the odds and the chances it can actually be reversed?
It depends a little bit on the situation. I do those.
Okay.
I did one this morning. So if you have a patient who is 6 years or less from their vasectomy, and they're with the same partner, there's about a 90% chance of successful pregnancy after reversal. The majority of patients I see are that 6 to 15 year range.
Okay.
Oftentimes with a new partner, the success rate is about 56% in those patients.
Okay, well the advancements in this part of medical technology has been amazing. And I know it's a lot different than it was probably 20 years ago. Yeah.
And doing the reversal is quite a bit different than the vasectomy. It's a very tedious operation done under a microscope.
All right, doctor, appreciate it. UrologyCentersAlabama.com for more information. We'll have a link on our website, and we made it through it. I appreciate it. All right, y'all have a good one. We'll be right back.